in terms of those of us who come from marginalized communities in the United States, being able to now study, become doctors and return to our communities. He has been doing that, training people from marginalized communities from all over the world for decades.
Eso es como vamos a volver como médicos y estudiantes de ciencia y conciencia, ¿no? When you ask me that question of why, as a U.S. citizen, I would travel hundreds of miles to Havana to study in the Latin American School of Medicine, I could have stayed in Atlanta. I could have went to any of these medical schools right there in Atlanta. But I decided to go to Cuba. We both learned the same scientific pathways. We learned the same treatment, the same diagnosis. But there was something different about the Latin American School of Medicine, the level of consciousness that the students are obligated to have.
It is one of the key characteristics that distinguish our training in Cuba. That in Cuba, it's already built into the system, a requirement for us to help other people. Here, it's lived because we see that example in all of our teachers. Almost all of them are people who have helped and have completed a mission. It's more than just a mantra. It's as something that's practiced. Cuba has never ventured out in these projects with the sole goal of earning something. It's been about building global health infrastructure. And I think that's the point that the world is missing. It's not just that people go elsewhere, they also help their neighbors, they help in their communities. And we see that in the way that the medical system is set up from the community up. Our exposure to patients from the very start is what sets us apart from other students in the world. We have 6-7 years of clinical exposure, and that is not just in the hospital, that's in the community, and in an integrated way of practicing medicine that does not really exist in many parts of the world. For us as graduates, understanding the difference, and then going back to the United States and seeing what doesn't exist.
A lot of my colleagues, when we graduated from medical school in the United States, we have $500,000 worth of debt. We're trying to figure out for the next 10 years, how are we gonna pay back our debt as US graduates? We don't really have time to really think about people who need us the most. But when you go to the Latin American School of Medicine, you get a full scholarship as a US citizen. You get to come back to the United States. You get to practice in different communities where a lot of doctors don't want to go. It comes with a different level of satisfaction.
As an African, it's important for us to understand how central Cuba has been in our liberation, not taking anything from us, but giving us a lot. Doing these student health brigades, we're able to understand what the health disparities are that we face locally and try to use the tools that Cuba teaches us in medical school to help dissect those problems and also create recommendations for our communities to follow.
Doing some free consults in the community, canvassing the community, knocking on doors, taking medicine to the people, expressing their different issues, their different medical problems.
La frecuencia 54.
We went to a hospital, we did free consults. These are the things that the Latin American School taught us. It is the responsibility, the doctors, the students, products of the Latin American School of Medicine to continue this vision of bringing medicine back to the community.
It's very clear when you see how Cubans have been able to set up these institutions in different countries. Guinea-Bissau is one of 9 other faculties that exist in different countries. The amount of resources it takes to build, not only build a medical school, but people, personnel in there, in those schools annually. These are doctors who are there all year long. They only have a break when the students have a break in the summer, and they go back year after year to teach generation after generation.
I just feel like this brigade transformed some of these students. I've witnessed it. Some of these students are inspired or motivated. This is something that I would like to see more students be able to experience. Hopefully we can make this dream come true by building an international camaraderie of doctors.
I'm very grateful for the medical training I have, but I can say that the human training I've had, the quality of character building I've had by being in this country that is under siege, I cannot get anywhere else.